How can trainers work with doctors for a prescription for exercise?
Well, that's a great question. And in order to answer the question, I'm actually going to go to the book. So in chapter 6, I talk about the exercise prescription and working with the doctors. And the very first thing that the health club and the trainers need to do is to have a script pad so their doctor can actually do a referral for the exercise and list any contraindications and medications that the GLP patient is on. Some of the things that they need to be looking at in terms of the prescription are, number one, hydration status. I've already talked about this in 2 other videos, and I'll continue to talk about it because that's going to be one of the big issues in terms of training. The other type of information they need to know is any other medications. I would say that if a person is taking Ozempic or Wegovy or Zepbound, they're probably not on insulin because there's a sort of not a good synergistic effect. But they may be on a blood pressure medication. They may be on a medication for depression. They may be on a medication for pain. All of those need to be taken into consideration when developing the initial exercise program and discussing with the physicians. The third is alcohol intake. Now, someone may ask the question, why would anyone who's trying to lose weight still drink alcohol? Well, people do, and we're going to need to know as a health and fitness industry how much alcohol that a person takes in during the course of a week or a month. And some days may be more, some days may be less. One of the other questions that trainers should talk about is undue muscle soreness. So if a person comes into a club and they work out one day and they're sore for 3 or 4 days or more, there's an issue that's underlying that's a little bit different than just general muscle soreness. Other things that trainers need to be aware of are, does this person suffer from dizziness? Do they have undue fatigue? Are they drowsy all the time, etc., etc.? So this is going to probably be related to the type of medication that they take and the dosage that they're taking. So you want to know their current weight status, you want to know any general behavioral issues, you want to do their body composition, and then you're going to go into what we call the biometric assessments. And all of these things, they kind of go into the pot when you have someone who comes into your gym with that initial exercise prescription from their doctor.
And how can I learn even more about GLP-1?
Well, log on to medhealthfit.com and click on the GLP-1 button.